Deputy Speaker, I'm glad that we've had the opportunity to have this debate today. And like other honourable members, I want to focus my remarks on the impact these changes could have on those with epilepsy, and thank SUDEP Action, as my honourable friend has mentioned, for the work that they have done to bring these concerns to the fore. And can I say I also agree with many of the concerns that my right honourable friend expressed in his opening remarks. I know that the Secretary of State, who was here previously, was unable to address the bereaved families and clinicians at the recent summit held by SUDEP Action, but I would ask the Minister today, and ask the Secretary of State, was in his place until recently, whether he would Secretary of State is there, whether he would meet with myself, representatives of SUDEP Action and other honourable members of this House to talk directly to families about the concerns that they have. Would the Secretary of State perhaps agree to do that? It would be very, very helpful if he could. Madam Deputy Speaker, medicine shortages pose a serious risk to people with epilepsy. As honourable members are aware, it's a high-risk condition requiring complex, tailored care, and many people with epilepsy, as other honourable members have said, are particularly vulnerable to changes to that care. I've recently met with families, those of Rachel Shah, whose daughter Emily died aged 19, shortly after a non-specialist prescriber made an error with her medication. The family and the non-specialist were entirely unaware of the risks of sudden unexpected deaths in epilepsy, and the error wasn't noticed. Quite shocking, Madam Deputy Speaker. Studies show that people who are on existing medications are put at risk when medicines are changed. Tried and tested systems mean that when there is a medicine shortage, specialist prescribers are involved in changes who have both expertise and access to the full patient record. There are known risk factors which can increase the risk of death amongst people with epilepsy. However, these can be carefully managed through open, positive relationships between clinicians and patients. These clinicians have had responsibility often for patients' medication, worked up with the patient, often for many, many years. The serious shortage protocols passed under the Human Medicines Amendment Regulations of 2019 gives pharmacists the right to supply a different quantity or pharmaceutical quality of medicine in the event of the country experiencing a serious shortage of prescription-only medicines. Pharmacists are skilled professionals in medicines, as other honourable members have said, and medicines management, but they are not specialist prescribers, nor are they specialists at assessing SUDEP or other epilepsy risks in individuals, nor do they have access to full patient records. I'll give way to the Minister.
I just, with your indulgence, Madam Deputy Speaker, I'd just like to reassure the honourable member for North Norfolk and the honourable gentleman. We don't consider that treatment for epilepsy would be appropriately covered by a serious shortage protocol for exactly the reasons that both honourable members have outlined, which are that this is specialist prescribing and very bespoke to the patient. So in the event of a shortage of those epilepsy drugs, the clear guidance would be for the pharmacist to refer the patient back to their prescriber. The shortage protocols will be very tightly defined within given circumstances as to what appropriate drug would be an alternative treatment. But these are by no means meant to be very one-size-fits-all.
I thank the Minister for that reassurance. I think we want to see that in writing, and that clarity is incredibly important. So when that guidance is published, the reassurance is there for people with epilepsy and their families. It's incredibly important. Laws that sought to allow changes in the supply of the prescription of epilepsy medications, we should remember this, were rejected in 2010 after a public consultation that highlighted major patient safety concerns. And MHRA guidance in 2017 includes vital safeguards against switching medication for people with epilepsy. So these issues have actually been interrogated in the past. A precautionary approach concerned with patient safety would include a number of things: analysis and openness about the causes of medical shortages, including an impact and risk assessment, an aim to avoid any risk of worsening medical shortages, following good practice in the regulation of medical shortages, including training and communication arrangements for all affected, and to include clear, robust and timely accountability to patients and the public for adverse events and avoidable deaths. Nurses and clinicians are not able to access a number of medications at the present time. They need to know which medications are on the list for likely shortage and what are all the necessary measures being exhausted to prevent those shortages. People with epilepsy are recognised in current legislation as being a high-risk group. They must be protected against medication shortages for any medication they take, not just their epilepsy medication, by ensuring that there is a requirement in the legislation and in any accompanying guidance for the involvement of the specialist prescriber at all times. To be fair, that's the assurance that the Minister sought to give this evening. It's not good enough to say, and I think this point needs reiterating, in the explanatory memorandum that protocols will not apply to certain epilepsy treatments where a brand is required. Any change to the MHRA 2017 guidance on epilepsy medication should be avoided, though if it is required due to serious shortage, it must be following public consultation with the involvement of the third sector and patients. And I think one of the problems with the debate tonight is it seems to me that patient groups feel they've been excluded from this process thus far. And I urge the Minister, in the spirit that she's engaged this evening, that if the Secretary of State isn't willing to make SUDEP action or doesn't have the time, perhaps the Minister will agree to do so with myself and other honourable members. I also want to say that the Government should look to make publicly available the list of medications at risk of shortage. People living with long-term health conditions and their clinicians knowing about serious shortages which may affect them provides opportunities for them to feed into any consultations and debate. An early warning system to prescribers is absolutely essential. This must, however, be extended to all specialist prescribers. Many are on the front line trying to ensure continuity of medication for patients and can provide the necessary reassurance to patients if they're aware of potential shortages. We shouldn't forget, Madam Deputy Speaker, the anxiety that this will cause amongst already extremely vulnerable people, which can lead to further health problems. So we really do need to see all those involved in this chain in a position, where appropriate, to offer clarity, maximum information and reassurance. It's also important that the Government should publish an operational framework and guidance to ensure good practice guidelines for managing medicine shortages within a safe framework, with a commitment by the Government to patient-centred and shared care decision-making. And, Madam Deputy Speaker, perhaps this is the most important point that's been made by other honourable members. It's still not clear, Minister, where accountability lies in the case of an adverse event or worse, a death, where there's been a failure of continuity of supply lines. It is not clear where accountability lies. Now, this is an issue that's been highlighted by the Pharmaceutical Defence Association, which obviously are very concerned about the negative effect potentially on pharmacists. But the greater concern is the potential effect on patients and families at risk. In conclusion, Madam Deputy Speaker, this law is not simply another complication caused by Brexit, but it may present serious challenges for many years to come. It is first and foremost about patient safety, and in those circumstances, the Government really do need to take appropriate time and care over these decisions.
Good,
Thank you very much. Madam